Hey there, sports psych enthusiasts. I'm Dr. Colin Fehr, and I want to share my passion with you. I love talking about ways to unleash the power of the mind. This recording is part of a larger lecture series I've created in an effort to make sports psychology concepts more accessible to a larger audience. The information contained in this series is especially well suited for students of sports psychology and is presented in a way that makes for easy listening for all. Welcome to Sports Psych Concepts.
Hi there, everyone. Thanks for joining me for another Sports Psych Concepts presentation. I want to dig into the impacts of eating disorders on athletes today as my topic. And this is, again, one of the things I always like to say when I talk about topics that may be more clinical in nature, is that depending on what your training and your background is, we want to keep that in mind as we go over these topics, because if we're not trained in the clinical side of things, then we need to understand, we need to learn as much as we can about these things so we can do the best that we can with when we're working with these athletes. But if our focus is mental performance and we have clinical issues present like this that are more of a mental health issue, then we want to make sure we have a good referral network and we know how to stay in our lane when we're going through these things. But either way, whatever our focus is and our area of emphasis, whether it's more on the performance side or the mental health side, it's good to understand the impacts of eating disorders on athletes as a way to inform what our approach is. So with that intro, let's jump into these topics. So one of the first things that I want to clarify is actually a common misperception out there that people who are dealing with eating disorders it's just their choice. They just don't have willpower, and that's all that it is. Where in reality, it's much more complex than that, especially when we're talking about clinical eating disorders. Disordered eating, maybe that's a little more on the choice side, but there can be more going on there as well, because biology is a real thing, and there can be things going on in our bodies that can be malfunctioning. Okay, the neural pathways, the chemical reactions, all of those things going on, that matters, and it can create a sort of static, is one way to put it, on the mind, where it makes it difficult to actually make the choices that align with our values or our goals. And so what might seem like a simple choice to an outside observer can actually feel overwhelmingly difficult. And so the maladaptive behaviors are like the only relief for the client, right? For the athlete who's dealing with this, it feels like it's the only viable option. So it's a little bit more complicated than just a choice, and that's an important thing to understand from the outset. So with all of that in mind, let's talk a little bit more about the neurobiological considerations. And these are certain things that there's certainly topics that you could really go off into the weeds and dig much more deeply. So I definitely encourage you to do that if these are things that are of interest to you. I'm just going to give you a cursory coverage of these right now. But to help us understand why eating disorders are so resistant to just simple choices, we need to look at a few of these neurobiological players. So the first one that I want to mention is serotonin, which is normally a neurotransmitter which helps us feel hungry or full. And this can actually become overactive in anorexia nervosa. So what that leads to is intense anxiety when eating. And so making, alternatively making a restriction of our diet feel like a sort of calming mechanism. Okay, so that can be a real chemical explanation or partial explanation for some of what is going on in individuals with anorexia nervosa. Okay, and then I also want to mention dopamine. So this is our reward chemical. This can malfunction. And so what that does is it dulls the pleasure of food, and it impairs decision making on that. Okay, so that obviously can play a role in whether it's just simply making a choice if we have some malfunctioning dopamine and we're not able to make decisions as well. And then there is vasopressin. So for those who purge, the purging can actually release vasopressin, which creates basically like a temporary, almost opioid-like high, which then reinforces the destructive behavior. Okay, so you have all of these things going on, and like I said, I encourage you to go and dig a little bit deeper. I'm just giving you little headlines on each of these, but it's fascinating to think about the role that all of these things can be playing in these conditions. And so I'll mention just a couple more. Leptin is the next one. So if you heard of this one, it's a hormone that it regulates appetite and metabolism. And for people who are starving, essentially, leptin will drop. And so paradoxically, that suppresses hunger signals in a body desperate for fuel. Isn't that kind of interesting? And so then it's working against us, whereas we think that it would be, it's paradoxical. You think it would be working in the other direction for us, but because we're in that state of starvation, that is what happens. And so just like collectively, we can look at this and say, well, hormonally, we have these neurons, or we have these neurotransmitters, and then we have these different hormones, just chemical messengers within the body. And when we have some sort of imbalance, it literally can rewire the brain's perception of food and our hunger sensation and even body image. So now that we have that background in mind, let's look at some of the actual physical effects of restrictive eating. So beyond just the mental struggles, particularly, of any disordered eating pattern, but particularly restrictive eating, it takes a severe toll on the body. And so it's important for us to understand that medical complications can occur regardless of an athlete's visible weight. Okay, so we can't just make a judgment call on someone's outward appearance of how much they weigh and what's going on right there. Okay, because there can be other things happening. Okay, with the nutritional imbalances there. There also can be cardiovascular effects. So for numerous reasons, the cardiovascular system is highly vulnerable, and the risks. One specific risk I should mention on this, it can include a dangerously low or slow heart rate. So bradycardia, we see that someone is not consuming enough energy and they can have really low or slow heart rate. They can have low blood pressure or even shrinking heart muscle. Okay, which is not, it obviously just doesn't sound good on the surface, but then from a physiological standpoint, it's not great either. But it can be challenging sometimes to tell the difference between an athlete who comes in and they're just fit, they're in shape, because their heart rate's going to be low. But someone who's starved and comes in and you test their heart rate, their heart rate is also going to be low. So it can be tricky to kind of assess those things. And so it's called the walk across the room test, and it can offer clues here, which essentially what you do with the walk across the room test is if an athlete is really in good shape, they'll get up, walk across the room and walk back, and their heart rate isn't really going to go up that much. They're going to be able to handle that because of their level of fitness. Someone who is in an extreme calorie deficit, that's going to put a lot more strain on the system, and their heart rate will increase, many times over what the fit athlete would. So you can just a simple little test where, okay, basic appearance, maybe I'm not seeing anything, but that little test can bring some of that to light. Now, there's also some metabolic consequences. So low blood sugar can be a serious risk. Athletes obviously need to fuel their body, and our body works really hard to maintain our blood glucose levels. So we don't want it to be really high either, but we also don't want it to be really low on the other end of that. And we'll see that in athletes who aren't consuming enough energy, but are out there moving and they're expending energy on the other end. There also can be gastrointestinal issues, constipation, gastroparesis, which is a condition affects your stomach, right? Your stomach is not working properly. The muscles aren't working properly to help you digest the food. And then there even can be skin and hair problems, dry skin, hair loss. Sometimes these are the types of things that might be more readily apparent. For example, individuals with anorexia nervosa, those who are dealing with that, they will sometimes have the growth of fine body hair. It's called lanugo. So newborn babies many times have this on their body, just like feathery like hair, and then it kind of goes away after a couple of weeks. And individuals who are dealing with anorexia nervosa may have this occur. They grow this on their body, and the thought here is that their body is trying to conserve body heat, trying to conserve that because they're under stress and they're underweight and all of those things. So that can be an outward sign of someone dealing with a restrictive eating disorder. So now that we got the restrictive side of things, let's shift and talk about the physical effects of purging. And obviously these can have severe physical risks with them as well. And so whether purging, as a reminder, this can happen through vomiting, so self-induced vomiting, a lot of different ways that people do that, or it could be laxative or diuretic abuse. Either way, whatever the method is, it can cause life-threatening electrolyte imbalances, just dehydration that's profound, kidney damage. So none of those things are a great effect of these things, but can also lead to dental damage, swollen glands in the back of the throat, esophageal tears, and even vision loss with some of the retching and the pressure that happens in the eyes in order for that to get that out. I mean, you think about puking is not very fun, throwing up, you get sick, and then it happens. It's really an uncomfortable thing to happen just one time when you don't have a choice. So to induce it, that it puts a lot of, you're repeating those stresses over and over again. So there are some other mechanism specific issues, like I was talking about, that related to the dental erosion, or they could have hoarseness in their voice. Maybe they're experiencing heartburn all the time, all of those things. And then there can be ipecac abuse. So if you've heard of ipecac syrup, it's not really as prominent of a thing as it used to be, but it was something that was prescribed if someone was suspected of consuming poison, some sort of toxin, and then you take ipecac syrup and it induces vomiting. Now they use things like activated charcoal and to help absorb some of the toxins, but ipecac has some. Essentially, it's a cardiac toxicant, and it can lead to irreversible cardiac disease by itself. So the physical effects of purging, a little bit different than those of restrictive eating behaviors, but equally problematic. Now we will turn our attention to some sex-specific impacts. So first, female athletes, and I'll talk about male athletes next. But so for female athletes, starvation can lead to a condition called hypothalamic hypogonadism, where essentially the body stops producing sex hormones, which are obviously really important for many different reasons. But this can lead to a condition called functional hypothalamic amenorrhea, where there's not enough estrogen there, and it's not just about periods or a woman's monthly cycles. It can really serve as a critical indicator of low energy availability that puts bones and cardiovascular health at risk. And so one other thing that's maybe related to this that I'll mention is oral contraceptive pills. They don't protect bone health. They actually induce withdrawal bleeding, and they may mask the true hormonal status for the female. And so all of those things are specific to females in this regard, and they're important things to understand, because ideally, if we're looking at what's our gold standard for menstruation resumption and bone health, is, well, the woman needs to gain her weight back to what it was previously, and that's what we're aiming for. Otherwise, it can be a situation where all of these things are at place in place. For male athletes, who are really often overlooked in this whole discussion on eating disorders, but in the sense of, well, how do we know when they're experiencing some of the different symptoms? It's like they're not, amenorrhea isn't something that's going to present itself in male athletes, but they do have some sex specific impacts or consequences here. So testosterone is a sort of the primary male sex hormone, will be decreased in these conditions. It'll also impact their bone health, their muscle mass, their mass and ability to recover there. And so both males and females are going to experience severe long-term consequences, for their bones in this regard, if they're not addressed through proper fueling and that weight restoration. And so other specific things for male athletes would be just things related to low testosterone, low sex drive, impaired sexual functioning, and increased body fat. Okay, none of those things that these male athletes are going to be wanting. So these can be sort of some signs or symptoms, types of things that can help a practitioner understand the ramifications if any of their male athletes are dealing with this. So now let's zoom back out a little bit and talk about some specific risk factors. So just besides the fact that athletes in general experience a higher prevalence of disordered eating compared to non-athletes, we can break it down on some other specific factors. So women tend to experience higher rates of eating disorder, disordered eating, than men do, right? Nearly a quarter of female athletes will report restrictive eating. Almost 1 in 5 have a history of an eating disorder, and then other factors are at play as well. So adolescents, particularly female adolescents, have maybe more prone, some of the different things that they're going through at that stage of life, but higher rates reported there. So that the type of sport, so athletes in sports that emphasize leanness, like endurance or aesthetic sports, like gymnastics, synchronized swimming, we show higher rates of these behaviors in those types of sports. And training volume is a factor there as well. So high training volumes just by themselves can contribute to menstrual dysfunction in females. And so you combine that with some of the other things that I've mentioned, and just being a female in a particular age group and then doing that type of sport may be at increased risk because of the convergence of those things. But beyond some of those demographic things, personality traits like perfectionism, that is something that we may see in certain athletes, and some just may have a strong drive to meet others' expectations. And then there's sport and social pressures. What should body shape look like? What do we need to look like to perform at our best? Those can be strong risk factors, and a lot of that comes from media consumption, especially appearance focused content, which there's a lot of that out there, of course, in social media. And so all of these different things will play a role, and can help practitioners just know what to look for, because obviously we can't overgeneralize with this, and we don't want to stereotype based on these things, but it can inform our approach when we work with athletes. All right, so now I want to zoom in on one particular aspect of this overarching topic today, which is, the impacts of eating disorders on athletes. Now, one of the most concerning practical examples of that is the direct link between disordered eating and injuries in athletes. So this is one of those things that research pretty clearly strongly supports, that whether it's restrictive eating that's just more on the disordered eating end of the spectrum with athletes, it's not, maybe it doesn't meet all the criteria for a diagnosis, but that even still, along with those clinical eating disorders, significantly increases the risk of injuries. And it's not just a problem for older athletes or for younger athletes. So older athletes will face similar increased injury rates as well. Okay. And this menstrual dysfunction, you hear this as a theme, it continues to come up because it's a sign of low energy availability. It's directly linked to more missed training and competition days due to injuries. And all this, so you just think about the different studies that have been done, low body mass index in combination with higher training hours, those might be mediating variables for, between menstrual dysfunction and misparticipation days, the short-term physiological effects, all of those things that an athlete experiences will impact their performance. And so taken together, it just suggests that the physiological stress on the body from inadequate fueling, because they're not getting enough calories, they're not eating enough, it makes athletes more susceptible to injury and less able to recover, which is going to directly hinder their performance. So we talk about it in the context of just injuries. Yes, that's important. That's definitely going to affect their performance, because now they can't even go out and compete. They can't even train. But even if they can, they're not going to be able to train at the level that they would like to. And so that's really important to understand, as from a sports psychology perspective, because we're interested in performance and enhancing performance. And this is something that has psychological elements to it that is going to interfere with their performance. So that's a good segue into this next and really final topic for today's recording. And that is the idea that it's important for us who are working with athletes to understand that the eating disorders aren't just psychological things, and they're not just physiological things. They're complicated, they're complex. Okay, and if it's a clinical eating disorder, it's a mental illness, mental disorder. It's the way we can look at it. It's a mental health situation, and there's profound medical consequences that can be overlooked in that instance. It's like, oh well, what is it that's going on? We'll just address the psychological things. So it's different than a lot of situations that present themselves with athletes that we're working with, where let's do some mental skills things, and we're going to do some of these psychological interventions that we know how to do. But there's more to it than that. The medical complications can be severe. So we have to understand that first and foremost. And we want to make sure we don't overlook some serious medical concerns, because we're saying, well, it's just this athlete has a low heart rate, and because they're fit, when maybe it's due to starvation, or athletes need to do extreme things. They need to make sacrifices in different ways to achieve their goals, and like those sorts of things. We got to be careful with those things. We don't want to overlook those things that could be a myth, and really a sign to look into this situation a little bit more deeply. And so a few other things I want to mention as I close out these main ideas is amenorrhea, so lack of a monthly menstrual cycle for females is sometimes considered a badge of honor in certain groups of athletes. Like, oh yeah, I'm working really hard and I'm training, and so I don't have my period, and that's why, when in reality it's a sign of energy deficiency. It's a sign that something's not working as it should in the individual's body. And so helping broaden perspectives and understanding on that and what that actually means. And just decreased performance in general, it might actually indicate a need for more fuel and rest, not just more training, because that's usually tends to be the default. Oh, why am I not performing well? I need to work harder, I need to train more, when in reality, it may be the opposite of that. And then we have things like refeeding syndrome or underfeeding syndrome. So if we're working with someone who's dealing with an eating disorder and they're coming back from that and they're going through, and we've got that multidisciplinary team, the nutritionist is working with them and they're having them, now they're starting to eat more, but they reintroduce food too quickly. And that can actually have become a deadly complication of that, where they have these edema and some other things, and so it's preventable as long as there's careful monitoring. And then on the other end of that, of underfeeding syndrome, is we're just starting their caloric intake too low, and that can be problematic as well. And then the last thing I'll mention on this is, anabolic steroid abuse, because this can play into these discussions, and it doesn't always get mentioned, so I'm just going to mention it here. But that carries its own significant health concerns, right? Things like liver dysfunction and cardiac issues, and the hair loss or hair gain, and sex-specific effects that go in either direction on that as well. So just to sum all of that up, because I know I threw a lot at you right there, is it's not just physical, it's not just psychological, it's complicated. There's lots of different things, and there's so many elements to include, and so we can't just use some sort of cookie cutter approach to try and guide our work with athletes on these things. So to summarize, I'll rehash the main things that I have addressed. We really did take a deep dive on these things. Hopefully I emphasized well enough that it's not just choices, they're biologically driven mental conditions. And, we see how those conditions can lead to severe physical consequences impacting virtually every body system. You got heart, hormones, bones to the gut. We discussed some specific vulnerabilities of athletes, males, females, things like how sport culture and social pressure, things like personality traits can contribute to that. And then talked about the link between disordered eating and increased injury rates, and the ability to recognize the medical components here, the medical elements, and making sure that we don't overlook those things. So lots of good things, but the impacts of disordered eating on athletes are significant, far-reaching, and very helpful for us to be educated on these things to be the most effective practitioners we can be. So thanks again for listening. Have an awesome day.
Thank you for listening to this recording in the Sports Psych Lecture Series. I hope you learned something. More importantly, I hope you learned something that you can apply in your life. Feel free to share this presentation with others who might be interested. And if you're interested in more content like this, visit the Fehr Advantage channel on YouTube, or find the Fehr Advantage podcast on Spotify, or visit my website at fehradvantage.com.